Hello, everyone. Welcome to the Narcissism Decoder. I'm your host, Dr. Anthony Mazzella. Today, I'm excited to bring you part of my interview with Lisa Taylor Austin. Lisa is a highly respected psychotherapist in private practice, where she integrates her experience as an EMRD trained therapist to help clients navigate their mental health challenges. Alongside her clinical work, Lisa shares her insights on her video channel, where she educates and empowers a wider audience. What I'm about to play for you is part 2 of our discussion on some key concepts that are crucial to understand if you're dealing with vulnerable narcissistic characteristics, either your own or perhaps someone close to you in your life. I strongly encourage you to check out part 1, which is available on Lisa's channel. I'll include a link to her channel in the show notes below, where you can find that episode and other fascinating material that she's created. This conversation with Lisa naturally builds on the themes I explored in my prior episode, where I delved into the origins of helplessness and its psychological impact. You'll notice some of the overlap between the two as Lisa and I discuss how this sense of helplessness intertwines with the vulnerable narcissistic characteristics of narcissism. Typically, I'd like to give you a quick review of the last episode, but since Lisa asked me to relate, how to relate to a vulnerable narcissist in your life, I needed to do some of that review to answer her question. You'll hear that as soon as I turn to the interview, which I'm going to do right now. So without further ado, let's dive into our discussion right at the point where she asked me, and we begin exploring ways to navigate the challenges of vulnerable narcissism in everyday relationships. I hope you find this conversation both insightful and informative.
Dr. Mazzella, are there any specific therapeutic approaches that are particularly effective in treating vulnerable narcissism?
Yeah, this is such an important question because in the social media literature, predominantly what you hear are descriptive factors. Like people are really good at describing vulnerable narcissism, but you hear far less on how does one treat something like this? Or if you're in a relationship with somebody, if you or somebody you know, or you're with somebody who has these vulnerable characteristics. And by the way, just to remind all the listeners, in a prior episode, which is on Lisa's channel, we went over descriptively what vulnerable narcissism looks like, how it presents itself, and we went into a particular theory in terms of how someone comes to be this way. And maybe that's a good place to start, Lisa, in terms of your question, because in thinking about, if we could call it treatment approaches or relating to somebody like this in your life, in my opinion, it's always really valuable to have a theory in mind, because when you could frame what's going on and why they're making these demands of you, it's a little easier to sort of cool down and put yourself in a more reflective state of mind, which is exactly what the relationship needs at this point. So let's just remind the listeners, and then please jump in, Lisa, because you were there for part 1 of this. So vulnerable narcissism, we said, is marked by a profound emotional fragility and an overwhelming sense of helplessness, coupled with a desperate need for validation. What sets vulnerable narcissists apart is the unique way they seek this validation. Unlike grandiose narcissists, who exude an air of superiority and confidence, the vulnerable narcissist is intensely needy and dependent on others. So rather than being overtly grandiose, they're overtly insecure. That's what Lisa and I were talking about. So when working with these individuals or relating to them, my primary goal is to truly understand and connect with them. So rather than viewing their needy behaviors, Lisa and I spoke about this too, and I said I would come back to it, as manipulative, I see them as rooted in a desperate need for empathy and support, but they're not able to communicate those needs in a genuine way. And this is, again, something Lisa and I spoke about, is they tend to communicate the needs in what we call the literal way, which just means they put like a demand on you to immediately meet a need, rather than doing it in what we call the representational way, which means that they have the capacity to use language to identify and express a need. So naturally, Lisa, that brings us to, in terms of relating to somebody like this in your life, if you decide that this is the type of relationship you want to pursue, instead of to just leave them, again, like most social media will suggest, just leave them or create a barrier, a boundary of some sort. What we need to think about then is how we can move the relationship from this literal way of interacting to this more representational way, if that makes sense. I don't know, Lisa, let me just check in with you there, because that's sort of the foundation that I'm setting so that you and I could build on that in terms of relating to these people.
It makes a lot of sense, Dr. Mazzella, because there's many people who cannot leave these relationships for various reasons. Maybe they have young children together and they just feel like they can't parent by themselves or have a household by themselves. Maybe it could be a financial reason. They literally financially cannot get away from this person. Other times it can be that they themselves are too enmeshed with this person.
Yes.
What is often called trauma bonding, right?
Yep.
That they can't leave and they want to stay. And as therapists, who are we to tell people what they should or shouldn't do?
Exactly. Yeah, I want to talk about that too, because I agree with that. I mean, again, in the content, the social media content, you hear so much of like people, professionals telling you what you should do and how you should leave. But I think this is where the theory that I subscribe to is what we call psychodynamic psychotherapy. And I think it lends itself really well to working with these individuals, because in that framework, the understanding is on not the manifest presentation of the vulnerability, the neediness, the clinging, and the demanding, but what lies right beneath that. So we want to understand the deeper roots and the struggles that these people are going through, so that this way we can address not the outcome of the problem, not the symptom, but what's going on underneath. And we know, Lisa, because you and I had a theory on this in the first part, which is that there were these early childhood experiences. And by the way, for everybody listening, this is just one particular theory that I think lends itself very well to explaining the vulnerable narcissist. But there are many different theories. But this one says that in early childhood, that they had these needs. They have a need for attachment. And because of a preoccupied, a depressed, a dismissing parental figure, that these needs went unmet. And when there's something that goes unmet that's necessary to live, by the way, that it begins to explain what Lisa and I talked about, the manipulation and the controlling, because when there's a big hole inside of oneself, there's a desperation to get that filled as quickly as possible. And in comes the demands on you to do something to actively take care of them, so that they then do not have to face whatever void or pain or vulnerabilities inside of them, if that makes sense.
Yes, that's how they're getting their needs met. And you explained that very well. Are there specific therapeutic approaches that you use that are particularly effective in treating vulnerable narcissists? Because I think most narcissists don't go to therapy, but the ones who do, I would venture to say, are probably more vulnerable narcissists.
Yes. Yep. You're absolutely right. So therefore, if we're going to relate to people like this, or if we're going to be working with them, we do want to have the tools, because these are the people who are more likely to show up, to your point. So a central technique within the psychodynamic framework is something called containment. The ultimate goal of containment is to provide an experience where genuine emotions are seen and understood. This process is invaluable for helping individuals develop a clearer understanding of their own and other mental states, which is often impaired with individuals with narcissistic traits. So the general concept, and you and I could break this down as we go along, is containment. And I'm curious, before I go into what does containment actually mean, or what does it look
Yes.
like? I'm wondering, have you ever heard of this before, Lisa? Like, have you heard of containment, or do you know anything about it?
I am very interested to hear what you're about to say about
Okay.
this because I'm an EMDR therapist,
Mm-hmm.
which is a trauma based treatment modality. And we use containment in
Mm.
EMDR.
Oh,
So
okay.
I'm very interested to hear if it's similar or different.
Okay, great. This is great. I'm really excited to be talking to you about this today because for most of my professional life, I've had many sort of theoretical tools, at my fingertips that I use with these patients who are all personality disordered patients are very challenging to work with. But for the first time, I'm trying to conceptualize a treatment model based on putting all these different theories sort of together, if that makes sense. So
Yes.
you're going to be the first one, okay, Lisa, to hear about this. Although I bounced it off of a colleague the other day, and I want to tell you the reaction that she had. But in part, let's say containment is one. This is number one. Like, not that there has to be these steps in any order, but these are the three main pieces of containment. So the first part is when you could take in another person's overwhelming emotions. Okay. The second part is then you make sense of them. And then the third part is you reflect them back in a calmer and clearer way that's easier for them to handle. And then when you could do these three steps, this helps the vulnerable narcissist feel understood and less burdened by their own overwhelming feelings that they don't know how to process. That's what we've been saying. So they can't process them. That's why the whole goal is to get you to do something for them so that they never need to process their vulnerable feelings. So this process of containment, I just want to make this part clear because there's a lot of confusion, at least in the circles I run around in. It's not just sitting there passively and fulfilling all their demands. It's not, just sitting there taking everything in and just saying, yes, I know how that feels. That must be very painful. It is not that. Instead,
Correct.
okay, good. So we're on the same page. Containment is about actively engaging, helping to clarify what's going on in the other person's mind and in your relationship with them, especially when they pressure you emotionally, financially, or literally to take care of them in ways that feel overwhelming or invasive. So let's give an example. I'm going to give a quick example, Lisa.
Thank you.
And then I'm going to invite you in. Okay. So imagine this situation where someone suddenly feels overwhelmed with helplessness and says something like, I don't know, or I don't know how to do that, or I just want you to tell me what to do, or I can't think about this right now. A containing response might involve gently engaging their curiosity rather than accepting or reinforcing their avoidance. For me, in my work with these individuals, instead of reacting as a punitive or rejecting figure like their caregiver might have done in the past and getting upset with them for resisting my help, you hear that, by the way, that these patients are resistant, which just drives me crazy. But I might say something like this. And again, I'm not trying to script anybody who's listening, but I want you to hear the words that I'm going to use. And we'll go into further details and I will use specific words, but just use them as a model in your mind of like what I'm trying to convey. So what I might say is, what's going on here? Can you tell me what just happened? A moment ago, you were actively talking about not having money because you're not working. And then you started to think about getting back to work. And then suddenly something happened and you said, oh, I don't know. And it's like your mind went blank. What went through your mind at that moment when you started to think about getting back to work? So let me pause there. Yeah, please go ahead. Jump in, Lisa. Okay.
That's really good because it starts to get the vulnerable narcissist to reflect and possibly have insight into themselves.
Yes.
Which they are often severely lacking.
Exactly. Yep. So that's one piece of it. And there are other pieces too. Like you could hear I'm taking in something, right? So it's like I'm not avoiding it. I'm not getting upset. I'm just sort of I'm doing several things. So I'm taking in their emotions. And like you just said, Lisa, I'm fostering curiosity. I'm also trying to make sense of what they're communicating by encouraging, like you said again, Lisa, reflection. And I'm modeling an alternative to reactive patterns that most likely they've experienced or acted out with many people in their life before. Because when they become hopeless or helpless, more likely than not, people step in. And I know this because I hear this all the time in my practice. Well, my other therapist used to tell me what to do. So I know there's like a pull, and that's hard to resist. But by doing this one thing, it's setting up like sort of three things that I'm communicating with them, if that makes sense, right, Lisa? So
Yes. Let's say someone's in an interpersonal relationship with a vulnerable narcissist. They're dating, they're married, they're in a partnership of a personal nature.
yes.
Can you think of an example of how a person might respond to the vulnerable narcissist that does what you just did?
Yeah, let's do it by example because examples are always helpful. So imagine a loved one says something like, you know how hard things have been for me. You know, my mornings are so busy and I just don't have time to make breakfast myself. I need you to wake up earlier to make it for me so I could start my day off right. Okay. Or I don't know how to handle everything on my own. Like that's what they're communicating. So as the listeners are hearing this, fill it in any way that you like, okay, with whatever example. But the main premise is a partner saying to you, look, I don't know how to do something, or I can't do it, or I'm too busy, and I need you to do this for me, or you do this the best. You're the best at this, so I need you to do it. Can't you just take care of this for me? You know, I really need you right now. I'm going through a lot. So the first step, again, in terms of containment, is this is a fancy way of saying it, but we'll break it down, is we want to metabolize the projection. That's a key aspect of containment. And by the way, this is the taking in that I just mentioned a moment ago. So you're taking in another person's emotional, overwhelmed response, right? So let's bring this back to the underlying theory. What leads to helplessness and vulnerability in the first place? Keeping this framework in mind helps us. Remember, I said this, so we could sort of cool down a little bit when these demands come at us, right?
Yes.
We could keep in mind that they come from deeper, unresolved experiences of neglect or unmet needs. To quote Lisa, I need you to do this, right? But that's a need. But they don't know how to express it. Remember, we keep saying that. They don't know how to appropriately express it in a genuine way. So it comes across in this literal way as a demand.
So it sounds like first the person takes it in and reflects it back to them.
Yeah, because we know these are painful feelings that cannot be fully experienced, right? Vulnerability is associated with danger because of those early frustrations, right?
Yes.
So instead, what happens is they externalize this through the act of trying to get something from you as a way to soothe or to avoid unmanageable emotions, okay? But once we recognize this, it allows us now to hold their emotions internally. So yes, Lisa, that's the taking in. We're holding the emotion that they have this need, but they can't express it. But once we do that, rather than reacting defensively or getting angry or dismissing them or immediately giving in, you know, like out of frustration, now we can slow down and reflect on the emotions behind their demand. And this creates a space. So just knowing what we know now, if you believe this sort of stuff that Lisa and I are talking about, this one theory, if you really believe this and you believe that they're really hurting inside, but they don't know how to express it, now that automatically creates a space and you are freer to respond in a way that's not defensive.
So then the person, after they take it in, they would clarify back to the vulnerable narcissist. So they might say something like, wow, it sounds like the mornings are really difficult for you. I had no idea.
Yes. Yep.
And then how do they model the containment for the vulnerable narcissist? Using your example with breakfast, what might they say?
Okay, wait, hold on. Let's just add one more thing to what you said, okay?
Yes.
Because before, like, again, I don't mean to be overly schematic with this stuff. Like, it doesn't work that way, but we might as well build a foundation and keep going deeper. So the only thing I would add, so you said, wow, I didn't realize that you were having such a hard time, right? So I would just add that, and you're hoping I can step in and make things easier for you. You see, that's the part now. You're beginning to label the part where they put the pressure on you. Now, instead of agreeing to wake up earlier, out of guilt or frustration, again, you might say something like this to Lisa, your part, what you said was perfect. You're having a hard time right now. I could see that. And I understand why this feels very important to you. Let's talk about other ways, right? That's what I would add to that piece. Let's talk about other ways we can make mornings easier for you.
Very good.
So now it's more of a collab. Remember, they dump and they purge. We said this in part 1.
Yes.
So now I'm trying to make it more of a collaborative effort to see if I can engage. So I'm there with them. You see, I'm involved and I'm in it with them, but not in an angry way. I don't know, does that last little piece that I added in, what are your thoughts about that?
Yes, I think that's very good, because my guess is the vulnerable narcissist is anticipating you're going to have an angry response. You're going to have a response where you just say, forget it and walk away. Or you're going to say something like, make your own breakfast, right?
Yep.
Because that's what they encountered in their young childhood.
Yes.
And they're carrying around that introject everywhere they go throughout their life and projecting it onto you.
Yes.
And by responding to them in an understanding way, you're not agreeing, you're not disagreeing, you're just understanding, reflecting, which is non-judgmental.
Mm-hmm.
I think that surprises them and disarms them.
Yeah. And because you're showing them also, just to add one, I'm agreeing with everything, but you're also, now you mentioned modeling, right? But you are modeling here because you're showing them that you processed that projection, right? That you processed it, you can handle it, and you can reflect back in a way that feels less threatening or accusatory. So the goal here is to acknowledge their need without agreeing to the demand or dismissing their feelings. And that's the modeling too, by the way. You're not getting caught up in what we can call an enactment, right? You're not repeating something. You remember you said projection, Lisa? So projection, you said they're anticipating you're going to respond in a certain way, because then that's what we call an enactment. Now the two of you are mixed into something and you're stuck, by the way. So now there's no growth. There's no potential for growth with that.
This takes a lot of patience on the part of the partner,
Mm-hmm.
and a real understanding on the part of the partner as to what vulnerable narcissism truly is.
Yeah.
Because, as we've mentioned earlier, it can come across and seem very controlling, very demanding, very manipulative, all the negative things.
Mm-hmm.
And the behaviors, if you look at them on the surface, or the statements that the vulnerable narcissist makes on the surface, are all those things.
Yes.
But as you're talking about and educating us about, if we keep in mind, that's not the framework that this person's probably coming from.
Mm-hmm.
They're carrying around these introjects from their young life and really trying to get someone to meet their needs.
Yes.
But they had to do it in an unhealthy way in their childhood. So now they're doing it in an unhealthy way with you.
Yeah, that's right. They had to, in their childhood, just to review, when they couldn't do it with their cries and their smile or whatever they were trying to do to engage their parents, then they turned to omnipotence. Then they turned to demanding. That's the sort of stuff you see when there are many temper tantrums, for instance, with children. So they're figuring out any way possible to survive. And that's still what they're doing with you. They're trying to survive. They're trying to get the nurturance that they need.
And I know we didn't talk about this today, but I just thought of this. This is very helpful, for example, with siblings. Maybe a person has a sibling that's a vulnerable narcissist, and maybe the person doesn't want to cut off the relationship with their sibling. I mean, this is their sibling. Perhaps they can only take them in small doses, or they don't particularly like certain things they say and do, but it's still their sibling. So there's a connection there, and many people want to keep that.
Yeah.
And so I think this could even help with siblings.
Yes. Let's just go one step further. I think there's time to take one more step and look at one more key aspect of containment. Okay.
Sure.
So after you do that first step, and I added in that other piece of trying to make it a collaborative effort, if you get any sort of sign that they hear you, then you could go further. You see, but this is how we kind of have to feel this stuff out. So if you get a sense that they're hearing you, then you could gently guide them to explore their own emotions by prompting them to reflect on the underlying feelings behind the request. You help them become curious about their emotional state. So now, in my mind, if I were to hear a story like this, where a spouse assumes you will or should prepare breakfast for them, I might wonder if cooking breakfast equates to feeling cared for or loved. However, it's too much of a leap to immediately connect these two things. Remember, they're in the literal mode, so they're not able to make a link like that. And making this assumption risk escalating the emotional charge of the conversation rather than fostering understanding. It might be better to reframe this sentiment into a reflective question that explores the connection without making a dramatic assumption. So here's an example, okay? And please keep in mind, I know I said this before, but I am not trying to script anybody who's listening. I just give these example of the words that I would use to convey what it is you're trying to convey to a loved one, because you have your own language with them.
It's very helpful to hear it.
Okay, good. So Lisa, I want to get your reaction, because this is what I did with a colleague. I shared this step 2, like this second critical part, and she had an immediate reaction. So I just want to see what you think about this. So again, back in that scenario, I might say something like, do you feel that my not waking up early to cook makes you feel less supported or cared for? If so, I'd like to understand that better so we can find a way forward. So let me pause there, because I want to tell you my colleague's reaction, but do you have any thoughts about that kind of intervention, Lisa?
I think I might say, if I was the partner, something like, well, when I don't get up and cook, does it make you feel like I don't care about you? I think you'll probably get an honest answer if you ask that question.
Yeah.
I really do. Even from a vulnerable narcissist, I think you're going to get a yes or a no.
Yeah. So the colleague that I told this to, is also a therapist in the field, and her response was very similar to yours, right? She was like, oh, that's a really nice way of asking it. And immediately she went into a case that she's treating this fellow who has a wife who puts all sorts of demands on him. Do this, do that, that whole thing about you do it the best, so I need you to make the coffee in the morning, or I can't go out until you do this. And she said to me, I said to him, finally, does it bother you? And he wasn't answering the question. Like, do you like doing these things? And as she was describing this, she said, listen, do you mind doing these things or not? Like, just tell me. And I was laughing, because what I realized is she was getting caught up in this whole enactment thing, right? Yes. In other words, he was doing to her, like he was telling the story not to figure anything out, what to do with his wife, who's making all these demands, because he could never say whether he was troubled by it or not. He just does it, like literally does it. That's the literal mode. But since he doesn't have the words, he then brings it to his therapist, and he presents it in a way that we're not really thinking about this. It's kind of like, I'm just dumping it on you and hoping you'll come in and tell me what to do. So she gets frustrated, and it was like a beautiful illustration of how this whole thing gets reenacted. And he too is kind of in it now with his therapist. I don't know if I may not be doing the best job explaining it, because it all happened so quickly and we didn't process it. But I was just thinking, like, so sometimes we could give these words like I'm doing right now, Lisa, but it does not mean that someone can go and do it. You see, that maybe that's the takeaway from what I'm getting into. And this is why I rarely ever try to script my patients in terms of what to say. Yes. I much rather try to understand why they don't handle it this way. And for him, he's not interested in breaking that dynamic. And for somebody else, it may be something completely different, that if they say these things and they don't literally do something for their loved one, they will be abandoned. You see, I hear that kind of stuff too once I start exploring it. So anyway, I digress just for a moment there, but I was like excited to hear, as soon as I came up with this second step of containment, it evokes strong feelings in somebody who's actually doing this kind of work with vulnerable narcissists as well.
Well, I think this gets at the vulnerable narcissist need. The other thing that I like about this, by asking them the question, does this make you feel like I don't care about you if I don't get up early and cook your breakfast?
Yes.
If they say yes, and you can't get up early and cook their breakfast,
yes,
then it gives you the opportunity to say, well, I love you and care about you very much, but I can't get up and make your breakfast because XYZ. However, I'm hearing that it's important to you. So then the partner can start to work with the vulnerable narcissist in a partnership to find a solution.
Yep.
I can't do that, but let's talk about maybe some other ways that, you might get your breakfast and you might feel like I care about you.
Exactly.
And then maybe the partner can offer a suggestion or an option.
Yeah, that's the whole goal. And that's it, Lisa. So that's the whole goal, is to turn it then to redirect, let's say, their demands into a conversation about their underlying emotions and needs. That's the goal. So if you could start then talking about how they feel so uncared for by you, that's amazing. Because once you, as painful as it is, but that's exactly where we want them to be, as painful as it is, it's much better than the alternative, which is just putting demands on somebody and somebody responding to the demands either with anger and frustration or actually doing these things for them, which doesn't solve the problem anyway.
Right. Partners have a tendency to do that because the vulnerable narcissist triggers in the partner oftentimes a parenting.
Yes.
And so this is helpful to both people, I think.
Yes. And you see, just one more thing, and then we have to wrap it up, but I'll just say, I think that's why in the social media content, predominantly you hear things more like you need to get away, you need to create boundaries. And people love hearing this stuff because inevitably that's a lot easier, believe it or not, than getting close to somebody like this and being there for them. So what I would say, the sort of the takeaway is, and we didn't even get to the third critical piece of containment, but you and I'm confident we'll get back to this, right? Because we keep meeting and this is always a lot of fun and enlightening. But the takeaway would be, when encountering vulnerability and helplessness, either in yourself or like in your partner, right? Let's say it's with your partner, just to follow this example. The goal is one must neither attack, demand that they do something, like make your own breakfast, nor withdraw. So don't attack, demand, or withdraw. If you desire to maintain a relationship with the vulnerable narcissistic person in your life, the goal is to engage with that person without judgment or dismissal, or helping them recognize that their needs can be communicated in ways other than through dependency or manipulation. So that's sort of my takeaway from this, Lisa, but I'll give you the last word, okay?
That's so helpful. I am very interested to hear in the comments, or however you have them on your podcast, from people who believe as they are vulnerable narcissists, what they think about what we just talked about. I'm very interested to hear.
Yeah, that would be wonderful. So with Lisa's invitation, please, as always, feel free to email me or respond in any way possible on any of my social media channels. And this time I would say, instead of saying, and I'll take it up, Lisa and I will take it up, right, Lisa? Because we'll be back together, because Lisa and I recorded part 1 and 2. And in both episodes, we didn't even get into half of the content that we aim to, right, Lisa? Like there's still, in other words, so much more to talk about, but we'll have to save that for the next one.
Thank you so much for your insight.
And thank you for being with us again, Lisa. It's always a pleasure to have you on the channel. You are always welcome back, and I feel confident that we'll see you again in the near future.
I'd love to come back. Thank you so much.
All right, everybody. Bye for now. Disclaimer alert. The Narcissism Decoder podcast is provided for general information purposes only. The content presented in this podcast is not intended to diagnose, treat, or cure any psychological condition related to narcissism. The content on this podcast should not be considered a substitute for professional medical advice, diagnosis, or treatment. For specific advice pertaining to narcissism or any other psychological condition, you could reach me directly. I am an experienced mental health practitioner who is always taking on new patients. If you would just like a consultation, I can do that too.